Insomnia, a sleep disorder that refers to any difficulty initiating or maintaining sleep during the night, whether chronic or not. Sleeping medication, which 105% of people use without recommendation. Around 40% have been using it for more than a year, and 20% have increased their consumption during the pandemic. That's right, my friends. Zolpidem is a sleeping pill that has become fashionable and has wreaked havoc on the lives of those who take it, including financial damage. According to the BBC Brazil report, people who took the drug and didn't go to bed immediately to sleep, in other words, who went off to do other things, had strange behaviors such as astronomical credit card spending, sleepwalking, falling, and hallucinating. And according to a letter published in the Rio Grande do Sul Psychiatry Journal, the inappropriate use of Zolpidem causes this type of disorder. The content of the publication tells a story of a medical student who took the medicine and sensed the presence of another person in the room. My friend, these medical students, my friend, they take medicine to stay awake. They take medicine to sleep. I never took those things at my university. I drank a lot of cachaça, but that's stuff too. But what is this medicine anyway? But in general, sleeping pills act on the brain by altering the neurotransmitters that regulate our circadian cycle. And with this, they end up greatly altering the architecture of our sleep, altering the configuration of the stages of sleep, including the stage of sleep called REM, which is very important for our brain. In the 1960s, benzodiazepines were the main sleeping pills used to control anxiety and were used above all in times of crisis. They are the famous black box warning whose drowsiness is just a side effect which can help you sleep, but over time this tends to wear off, leading the patient to increase the dose more and more, creating dependency and more side effects, with memory problems and even dementia. What's more, this type of medication takes a long time to leave the body. If you take a benzodiazepine one night, you know that the next day, half of the dose you took will still be in you, which can make you sleepy and inattentive during the day. And that's one of the reasons they created sleep inducers like Zolpidem, which disappear from the body in a few hours. Another noteworthy point is that both benzodiazepines and sleep inducers such as Zolpidem make the brain more sensitive to the neurotransmitter GABA. But while benzodiazepines act on several neuron receptors, Zolpidem acts on just one area that is specific to sleep. In theory, because it is more specific, more localized, this would cause fewer side effects, less dependence, and this has made its prescription less controlled. In conclusion, sales of Zolpidem increased by 10,050%. And the worst thing is that this trend is among young people and is only growing every day. But what side effects can this drug cause? The first is weight gain. Zolpidem can make you fat when it causes a problem called sleep-related eating disorder. So you'll end up feeling hungrier and eating more while using Zolpidem. There's also the risk of a problem called restless leg syndrome, sleep apnea, and even depression. And the worst thing is that this urge to eat comes on at night when the person has taken the Zolpidem. What's worse, they don't always remember that they raided the fridge. Sometimes they get up and eat. It's unconscious. Therefore, the best thing to do is to treat these conditions before using Zolpidem. This will greatly reduce the risk of developing the eating disorder. I've always suffered from chronic insomnia. After learning about melatonin, that's it, sir. Why use Zolpidem if there's melatonin? Melatonin will help you. The second side effect may sound strange, but it is. You know what? Making debts. Man, that's really dangerous, you know? There have been many reports of people making stupid and inconceivable purchases online because they were in an altered state of consciousness due to the medication and had to pay an astronomical credit card bill. And the woman can't even dream of using Zolpidem. So Zolpidem does this kind of thing. It's very dangerous. It can even lead to accidents in home and outside.
Hey you guys, are you enjoying our content? Why I'm asking this? Because according to our channel analysis, 97% of the people who watch us are not subscribed to the channel. Do you believe this? So I sincerely ask, if you have liked our content, subscribe to our channel. Let's make this content reach everyone around the world and let's make this a healthier world, okay? So subscribe our channel and God bless you.
In any package leaflet for sleeping pills, it says not to drive or operate machinery after taking the drug. I don't know how there's still some people who does it yet. Studies have already revealed that when you take this type of medicine, It increases your chances of having an accident by 15%. Zolpidem causes reactions similar to drunkenness. A study in South Korea on Zolpidem consumption and car accidents led the FDA to change the dosage for men and women. For women, the recommended dose is 5 milligrams a day, and for men, 10. A fourth dangerous side effect is hallucinations. This disorder can last from 1 to 7 hours, and it can happen in people who are already taking antidepressants, not least because people who have problems such as stress, anxiety, depression already take these drugs and can add to them. There have even been reports of family tragedies caused by taking Zolpidem. Fifth side effect, falls. My father was a victim of this. It wasn't specifically with the Zolpidem, but my father started the process of his health deteriorating with a fall. Because he was a bit depressed, and the doctors gave him a lot of controlled medication and he collapsed at night. Okay, femur fracture. That was the beginning of the end. These drugs make the body sluggish and inattentive, increasing the risk of falls, especially in people over the age of 65. Then you get an older man with a prostate problem sleeping at night. Then you get up to go to the bathroom drunk and you fall, my friend. And like any fall, there's a risk of head trauma, a fractured femur or hip, and bruising. Therefore, care must be taken with a light to illuminate the room when the elderly person gets up, and stay away from stairs. Sixth side effect, respiratory infections. Prolonged use of Zolpidem can lead to sinusitis, ear infections, and sore throats due to allergic reactions. Impaired memory is our seventh side effect. While Zolpidem is acting, it can impair memory as well as confuse thinking, sleepwalking, and agitation. And when it was created in the 1980s to counteract the odiazepines, Zolpidem promised to affect memory as little as possible. But if the drug leaves the body more easily, these effects shouldn't happen, right? That's not what a study in Taiwan revealed. In that study, people who took the drug more than 180 times over the course of a year were more likely to develop Alzheimer's. Several studies show that this sleep inducer cannot be used continuously. Eighth side effect, inappropriate behavior. Cases of aggression, inappropriate messages, and photos sent via messaging apps. Email messages are also very common. I mean, Zolpidem and cell phones, they don't go together at all. Ninth side effect, cancer and death. A study in Taiwan revealed that Zolpidem users were more likely to develop cancer than non-users. My friend, after all this, are you still going to use Zolpidem? Drugs can cause viral infections, lower immunity, and increase the free radical index in the body. Over the years, consumers of the drug have become dependent, which can cause an overdose leading to death. But this risk is not restricted specifically to Zolpidem. Other sleeping pills can also cause this. And finally, violence. It may sound surreal, but there have been cases of murders due to the use of the drug. Despite the fact that the deaths were non-standard, one-off cases of extreme violence, the drug alters behavior, even more so if alcohol and anxiolytics are also taken. What's more, in these cases of extreme violence, the dose was higher than prescribed. In other words, they took it wrong on their own. In other words, he didn't even follow the doctor's instructions. There have been reports of artists taking more than 10 capsules a day in order to be able to wind down from their busy concert schedules, risking an overdose. So be very careful with the dosage of this medicine. Never take more than one pill. In fact, it's best not to take them at all. Sleep inducers, like any medication for continuous use, cannot be stopped overnight, and weaning off is gradual. And everything should be done with the doctor's advice, never on your own. What's more, many doctors say that you shouldn't use this medication for more than 2 weeks. However, there are studies of patients who use the drug for up to a year without becoming addicted. So guys, I know there are a lot of side effects. I know that in some cases you will feel the need, but first choose other things. Melatonin, 5-hydroxytryptophan, lavender essential oil, for example. And it's all a question of common sense and not self-medicating, since it's not hard to buy, right? But we mustn't forget that these remedies are just a tool for improving insomnia. There's also cognitive behavioral therapy, which is often conducted by a psychologist who specializes in sleep. And then, during the weekly meetings, the patient and the therapist begin to have changes in habits, changes in beliefs and perspectives related to the bedroom, related to the bed, to sleeping. One interesting thing, I was talking to my son Arthur this week. He has his own room and he studies in the living room, even though he has a desk in his room. But he said, Dad, I don't like studying in the bedroom because in my mind, the bedroom is a place to sleep. That makes sense. When his brain is in his room, it's all ready for lying down. Well, my friends, that's the message. Avoid sleeping pills as much as possible, and a big hug. Live healthy, live with passion and with God in your heart. Bye, guys.